let's dive into a topic that often flies under the radar but affects millions of men around the world: prostate health and the early signs of prostate cancer. Despite its impact, it's a subject that doesn't get talked about nearly enough. In the US alone, over 268,000 men are diagnosed with prostate cancer each year. That's not just a number, it represents fathers, brothers, partners, and friends, people we care about, so it's incredibly important to bring this conversation into the open. Catching prostate cancer early can make a huge difference in how it's treated and in the chances of a successful outcome. The sooner you spot the symptoms, the quicker you can get medical help, which is crucial for managing the disease effectively. But this isn't just about the medical side of things. Knowing the warning signs also helps you feel more in control of your health. It's about being informed, proactive, and ready to take action when needed. This video isn't just about sharing information, it's about making a real connection with you. We're here to explore not only what the warning signs are, but why they matter. Whether it's for your own health or for someone you care about, understanding these signs could be a lifesaver. So stick around as we walk through the 8 key warning signs of prostate cancer that everyone should be aware of. Your health, or the health of someone close to you, could depend on it. Warning sign number 1, difficulty urinating. One of the earliest signs that something might be up with your prostate is a change in your urination habits. If you find yourself having trouble starting to pee or struggling to hold it in, it could be more than just an inconvenience. It might be a sign that your prostate needs some attention. Normally, your urine should flow easily from your bladder through the urethra. But when the prostate, which wraps around the urethra, gets enlarged or inflamed, sometimes due to cancer, it can squeeze the urethra and mess with that flow. When this happens, you might notice a few things. Your urine stream could become weak or slow, you might feel like you can't completely empty your bladder, or you might suddenly need to go in the middle of the night. Starting to pee might also become a challenge. These symptoms are not something to brush off. They could be early warning signs of prostate cancer. Getting checked out by a doctor early on can make a huge difference. The sooner you catch any potential issues, the better your chances of effective treatment. Ignoring these symptoms could allow the disease to get worse, making treatment more complicated. Staying aware and proactive with your health is the best way to keep prostate cancer at bay. Warning sign number 2, decreased force in the stream of urine. Another sign that your prostate might be causing trouble is a noticeable drop in the force of your urine stream. If you're finding that your usual flow isn't what it used to be, it could be because your prostate is putting the squeeze on your urethra. The prostate, a small gland that surrounds the urethra, can become enlarged or inflamed, especially if cancerous cells are present. When this happens, the urethra narrows, making it harder for urine to pass through. This pressure results in a weaker stream of urine, and you might even find yourself straining to get things moving, something that was never an issue before. Not only can this straining be uncomfortable, but it can also lead to other problems like bladder stones or infections, especially if your bladder isn't fully emptying each time. It's important not to shrug off these symptoms as just part of getting older. While conditions like benign prostatic hyperplasia, BPH, are often the culprits, prostate cancer can present with similar symptoms. The key is to get checked out early. Doing so can help catch any issues before they become more serious, allowing for better treatment options and outcomes. Warning sign number 3, blood in semen. Seeing blood in your urine, known as hematuria, is one of those signs that should never be ignored. It's a red flag that something's not right, and while it could be caused by less serious issues like an infection or kidney stones, it could also be a sign of something more serious, like prostate cancer. As prostate cancer progresses, it can start affecting nearby tissues, including the urinary tract, which can lead to bleeding. Sometimes the blood is so faint that it's only detectable with a microscope, but in more obvious cases, it can give your urine a pink, red, or even brownish color. No matter how much blood you see, its presence is a clear signal that you need to get checked out. This isn't something to put off. Seeking medical attention right away is crucial, because finding the cause of blood in your urine could lead to early detection of prostate cancer or other serious conditions. Early treatment can make a world of difference, offering more effective options and a better prognosis. Plus, dealing with this symptom promptly helps prevent any further complications that could come from the underlying issue. Warning sign number 4, persistent pain or stiffness in lower back, hips, or upper thighs. If you're dealing with persistent pain or stiffness in your lower back, hips, or upper thighs, it's something to take seriously. This kind of chronic discomfort could be a sign that prostate cancer has moved beyond the prostate gland and spread to the bones, which is a common site for prostate cancer to metastasize. When prostate cancer spreads to the bones, it can cause a lot of trouble. Cancerous cells start growing within the bone tissue, disrupting the natural balance and leading to weakened, fragile bones. This can result in painful lesions, making your bones more susceptible to breaks or fractures. The most affected areas are often the pelvis, spine, and ribs, leading to constant nagging pain that doesn't go away with rest and might even get worse over time. This type of pain is a significant warning sign because bone metastasis from prostate cancer is an advanced stage of the disease. It can drastically impact your quality of life, making everyday activities challenging and uncomfortable. Whether the pain is dull or sharp, it's important not to ignore it, as it could indicate a serious progression of the disease. To get to the bottom of what's causing the pain, your healthcare provider might recommend imaging tests like X-rays, Connecticut scans, MRIs, or bone scans. These tests can help determine if the cancer has spread to your bones and guide the next steps in managing your condition. Warning sign number 5, painful ejaculation. Painful ejaculation is a symptom that shouldn't be overlooked, as it can signal underlying prostate issues. This discomfort might show up as a sharp, burning, or painful sensation during or right after ejaculation. Not only is this distressing, but it can also have a big impact on your sexual health and overall quality of life. The prostate gland plays a crucial role in the male reproductive system, producing fluid that makes up a large part of semen. When the prostate is inflamed, infected, or affected by cancer, it can lead to pain during ejaculation. Conditions like prostatitis, which is the inflammation of the prostate or prostate cancer, can cause swelling or irritation in the area, disrupting normal function and leading to this painful experience. In some cases, painful ejaculation might be a sign of more advanced prostate issues, especially if cancer cells are affecting nerve pathways or other structures in the pelvic area. This pain might not just occur during ejaculation, but could also be felt during other sexual activities or even linger after the activity has ended. If you're experiencing this kind of pain, it's important to see a healthcare provider. They can perform a thorough evaluation, which might include a physical exam, urine tests, and possibly imaging studies or a prostate biopsy if cancer is suspected. Warning sign number 6, unexplained weight loss and loss of appetite. Unexplained weight loss and a sudden loss of appetite are red flags that can sometimes point to the presence of cancer, including prostate cancer. When these symptoms show up without any obvious cause, like changes in diet or exercise, it's important to take them seriously and seek further medical evaluation. In the case of prostate cancer, sudden weight loss and a dwindling appetite might be signals that the disease has progressed and is starting to affect the body on a broader scale. Cancer can disrupt the body's metabolism, leading to a reduction in muscle mass and noticeable weight loss. Additionally, tumors can release substances that suppress appetite or interfere with how the body processes nutrients, which only adds to the weight loss. These symptoms don't just take a toll on physical health. They can also impact emotional and psychological well-being. Losing weight and appetite can sap a patient's strength, making it harder to cope with other symptoms or endure treatments. This can create a challenging cycle where a lack of appetite leads to further weight loss, which in turn lowers energy levels and diminishes quality of life. If you or someone you know is experiencing unexplained weight loss or loss of appetite, it's crucial to consult a healthcare provider. Warning sign number 7, fatigue. Fatigue is something we all deal with from time to time, whether it's due to stress, lack of sleep, or simply overdoing it. But when fatigue becomes a constant, overwhelming presence that doesn't go away with rest, it's a signal that something more serious might be going on, including the possibility of cancer. In the case of prostate cancer, fatigue can be particularly troubling. It's not just the everyday tiredness you can shake off with a good night's sleep. It's a deep, persistent exhaustion that lingers, affecting your ability to function and enjoy life. This kind of fatigue might stem not only from the cancer itself, but also from how the body responds to the disease. Cancer-related fatigue is often more severe and long-lasting, making even simple daily tasks feel like a struggle. The reasons behind this type of fatigue are complex. Cancer can increase the body's metabolic demands as it fights the disease, while also producing substances that contribute to feelings of exhaustion. Pain, emotional stress, and the side effects of treatments like chemotherapy, radiation, or hormone therapy can further drain your energy, making the fatigue even worse. Because fatigue is such a common complaint, it's easy to dismiss it as just part of life. However, if you or someone you know has a history of prostate cancer or is at risk for it and is experiencing unexplained persistent fatigue, it's important to take it seriously and talk to a healthcare provider. Catching this symptom early could lead to a quicker diagnosis and more effective management of any underlying conditions, including prostate cancer. Warning sign number 8, swelling in legs or pelvic area. Swelling in the legs or pelvic area is a serious symptom that can signal the spread of prostate cancer, especially in more advanced stages. This swelling, known as edema, often happens when cancer spreads to the lymph nodes or blocks the pathways that normally drain fluid from the pelvic region. When prostate cancer reaches the lymph nodes in the pelvic area, it can block the flow of lymphatic fluid, which plays a crucial role in removing waste and transporting immune cells throughout the body. This blockage causes fluid to build up, leading to swelling in the legs, ankles, or pelvic area. Additionally, if the cancer grows large enough to press against blood vessels, particularly veins, it can slow down or stop the blood flow back to the heart, causing even more fluid to accumulate and worsen the swelling. This type of swelling isn't just uncomfortable. It can lead to other problems like pain, an increased risk of infection, and reduced mobility. It's a sign that the cancer has advanced and may be affecting your body on a larger scale, requiring prompt and aggressive treatment. Doctors can use imaging tests like CT scans or MRIs to figure out how far the cancer has spread and decide on the best treatment plan. Managing the underlying prostate cancer is key to reducing the swelling and preventing further complications. This might involve a combination of treatments, such as surgery, radiation, or chemotherapy, aimed at shrinking the tumor and relieving the blockage causing the swelling. Recognizing the warning signs of prostate cancer, like difficulty urinating, blood in urine or semen, persistent pain, unexplained weight loss, or swelling, is crucial for catching the disease early and starting treatment. Early detection can lead to much better outcomes, so don't hesitate to see a healthcare provider if you notice any of these symptoms. If you found this information helpful, please consider subscribing for more health-related content and sharing this video with your friends and family to raise awareness and potentially save lives. Early intervention makes all the difference, and staying informed is a powerful tool in the fight against prostate cancer.